So, here today to provide a better understanding of just how important our sleep is to our overall health is Dr. Bhutani. She's a dermatologist and clinical researcher in the Department of Dermatology at UCSF. She serves as a co-director of the Psoriasis and Skin Treatment Center, a world-renowned clinic dedicated to the care of patients with psoriasis. Her clinical expertise includes the treatment of complex, treatment-resistant cases of inflammatory skin diseases using unique combinations of topical agents, systemic treatments, biologics, and phototherapy. She also directs the Dermatology Clinical Research Unit, where she utilizes her advanced training in clinical research methods to oversee numerous sponsored and investigator-initiated clinical studies. She is currently the PI for 6 clinical trials developing new therapeutics or diagnostics for psoriasis, atopic dermatitis, and alopecia areata. Her research thus far has been focused on assessing and improving quality of life and mental health in patients with psoriasis by treating their skin disease effectively. She now would like to expand upon this focus and look for methods to decrease the stress burden of psoriasis and improve patient well-being in the hopes of improving quality of life in a new and unique way. Nutrition, exercise, sleep, social connectedness, and mindfulness are the 5 pillars known to increase overall wellness in both healthy and diseased patients. Over her career, she hopes to look further into each of these aspects and their importance in inflammatory skin disease, starting with a research program focusing on sleep in psoriasis and its impact on disease severity, mental health, and cardiometabolic comorbidities. So, warm welcome to Dr. Bhutani. We are so excited to have you.
Hi, everybody. Thank you so much, Renee, for that really kind introduction. I'm really excited to be here today and talk about one of my favorite topics, which is the impact of sleep on psoriatic disease. We've been doing a lot of work here at UCSF related to this, so I'm excited to talk to you more about this. These are my disclosures, none of which are relevant for the talk today. Okay, so today we're first going to talk about why is sleep important, just in general for our general health. We're going to talk about consequences of sleep deprivation. So what happens if you're not getting enough sleep, especially over long periods of time. Finally, because we're here for the NPF conference, we're going to talk about sleep and its impact on psoriasis. And then finally, we're going to talk about future directions and research that we're doing here at UCSF to further study the connection between sleep and psoriasis. So my guess is that over the last 3 to 5 years, if we were in a live room and I asked everybody to raise their hand, how many of you have either read an article, seen something on TV, heard a podcast, something about the impact of sleep? Yeah, I already see a few hands in the audience. Everywhere you look, there are sleep trackers, your Apple Watch, your Fitbit. People are really kind of, really obsessed with sleep at this point in time. There's lots of books being written, and the mattress industry in the US, which I think is a crazy statistic, is a $50 billion industry at this current point in time. So people are really, really understanding the importance of sleep. And that's because many are calling this the sleep revolution. But what's really interesting is that up until just a few years ago, maybe in the 1950s or 60s, people who actually focused on sleep were either labeled as being lazy or unmotivated, or we have these terms like you snooze, you lose, or I can sleep when I'm dead. But it really wasn't until the advent of sleep medicine in the 1950s when we really started to learn about why is sleep important. Again, what are the consequences if we don't get enough sleep? And so that is based on that research. That's why we're seeing this huge resurgence in a focus on sleep. So sleep serves a lot of really critical functions. I'm just going to talk about a few important ones here today. So one is memory formation. There's actually been lots of studies to show that if someone's not getting sleep, you actually can't form long-term memories. I think about sleep as almost when we're sleeping, it's kind of like when files are going from your local desktop and being uploaded into the cloud, which is your long-term memory. And without sleep, you actually can't form those long-term memories, and you won't be able to recall things later on when you're asked to recall them. But just as important as a declarative memory or our thoughts and memories is immune memory. And we know that without sleep, we actually also can't have a highly functioning immune system. And again, lots of studies have shown that through if someone is not sleeping adequately, their immune system is not functioning at its peak performance. I love this study because this kind of proves this. So this was a study done by one of my colleagues here at UCSF, Eric Prather, who's a very prominent sleep researcher. And he actually looked at response to vaccines based on how much sleep someone was getting the night before. They took people and they gave them the hepatitis B vaccine, and they separated them by how much sleep they were getting prior to getting the vaccine. As you can see, the people who were getting less than 6 hours of sleep had the least response to that vaccine, whereas the patients who were getting greater than 7 hours of sleep had higher responses. It's this perfect dose-response relationship, we call it. He did a very similar study with the flu vaccine and showed that the most important nights were the first 2 nights before getting their flu vaccine in order to optimize response to that vaccine. So I think these beautifully show the impact of sleep on that immune response and how important it is. The other thing that sleep is important for, it's actually during sleep when our brain clears out metabolic waste. So during the day, our brain is functioning. It's actually creating a lot of byproducts, a lot of extra chemicals and things that we actually don't need. And if those were to accumulate over time, could cause problems. And there's studies that show now that it's during sleep that a lot of that metabolic waste is actually cleared out. We have these specialized lymph vessels called the glymphatic system that enlarge, and the flow through those lymph vessels increases during sleep to kind of just wash out your brain. I think of this like running the dishwasher at night. This is what I usually do, right? I fill up all the dishes and then I wash them in the middle of the night. And I think that's also what's, going on in our brain. So another really important function of sleep. But what are consequences of insufficient sleep? Now, there's actually both short-term consequences and there's long-term consequences. And I'm going to talk about both a little bit today. So first, let's talk about short-term consequences. Now, we've always heard, if you don't sleep enough, you're going to get sick, you're going to catch a cold, right? We've heard this, from our families, from our neighbors. And this was another study by Dr. Prather, which actually proved that this might actually be true. Now, I don't know how he got this research approved, but what he did is he took patients and he actually kept them in kind of a hotel setting for a course of a week, and he manipulated their sleep. So he made sure that, some patients were getting less than 5 hours, some were getting 5 to 6, and then others were getting adequate sleep less than 7 hours. And then what he did is he actually went in and he injected the cold virus into their noses and exposed them to the cold virus. And then he followed them for the next few days to see who actually developed an objective cold. And as you can see, the patients who were getting less than 5 hours or less than 6 hours of sleep were more likely to actually develop that cold versus the patients that were getting greater than 7 hours of sleep. So I think that's really fascinating, again, showing that connection between sleep and the immune system, and even as little as 1 week of sleep making an impact on your susceptibility to getting an infection. Sleep loss also makes us more reactive to stress. So this was a study on the left here. This graph shows they took patients and they actually exposed them to a stressor, and they looked at their cortisol, which is a sign of how stressed they basically got after that exposure. And the bottom line, or actually the dashed line, is good sleepers, so people who were getting good sleep. And then the top line is people that were getting poor sleep. And as you can see, the people who were getting poor sleep were more likely to actually react to that stress versus people who were getting active sleep. And I think we can all relate to that, right? When you're tired, when you're cranky, you're more likely to respond to things in your life versus if you're well rested. I thought what was really interesting is that they were most likely to respond to were actually the low-level stressors. So when they were exposed to high-level stresses, they actually did okay. But when it was the low-level things, when it was those little things like forgetting your keys or not being able to find your phone, those are the things that set people off. And so that was a really interesting finding of this study as well. And I think any of us who have been around a sleep-deprived toddler could tell you that sleep loss can lead to emotional reactivity. And there's been lots of studies here to show that when somebody is not sleeping well, their brain centers that are linked to emotional reactivity light up and cause kind of greater emotional responses than maybe we would like when we're well rested. And finally, sleep and accidents. So, sleep is really important. The National Highway Traffic Safety Administration estimates drowsy driving to be responsible for an annual average of 83,000 crashes a year, and 886 of those are actually fatal. So, this is really, really an important consequence that can impact any of us, right, without us even knowing. They estimate that being awake for at least 18 hours is the same as someone having a blood alcohol level as of 0.05. So basically, we're drunk driving when we're not actively sleeping. And historically, a lot of the greatest accidents in history actually have all been linked back to sleep deprivation, whether it be the Exxon Valdez or any of these other accidents. The investigations have shown in the end that most of the people that were responsible were sleep deprived. Okay, so what about the long term? So I talked about short term, right? Even 18 hours of sleep can influence someone's driving ability, but what about in the long term? So when we look at chronic sleep loss, if someone is not sleeping well over long periods of time, they actually are more likely to be obese. This graph over here on the right shows that that patients who are sleeping 6 hours or 7 hours of sleep are actually more likely to have a higher body mass index or higher weight than someone that was sleeping adequately 8 or 9 hours. Now you can see this is kind of a U-shaped curve, which I thought was interesting at first. So it seems like the people who are sleeping between 7 and 8 hours have the lowest BMI. And we think this happens because if you're sleeping too much, 8 or 9, 10 hours at night, you're probably not sleeping well. You're probably waking up a lot in the middle of the night. Your sleep is probably very fragmented. So that's why sometimes these curves look U-shaped. It's the people that are getting low amounts of sleep are having the bad consequences, but also people that are getting too much sleep, but that's probably because their sleep quality just isn't so good. The interesting thing is also not only are these patients have a higher BMI, but the sleep restriction also increases their desire to eat foods that are high in sugar and fat content. And so again, I think we can all relate to this. If you're sleep deprived, you start to crave these kind of unhealthy foods. And again, this just becomes a vicious cycle. We see a very similar curve for diabetes. So patients who are getting low amounts of sleep are more likely to develop insulin-dependent diabetes or poor quality sleep. And this is a lot of numbers on this slide, but basically a very similar trend for cardiovascular disease. So patients who are sleeping less than 5 hours or 6 hours a night are more likely to develop things like heart attacks and cardiovascular disease compared to someone who's sleeping 8 hours a night. And then we know the connection between sleep and mood disorders. Sleep loss is actually one of the criteria that we use to diagnose depression and mental health disorders. But there's also studies now in adolescence that show that if people are not sleeping at young ages, they're actually more likely to develop mental health disorders later on in life. So again, another vicious cycle. And then again, because I'm a dermatologist, I have to talk about sleep quality and skin health. Studies have shown that people who get good sleep are actually objectively, when people are rating their ages, they actually look younger if they're getting good amounts of sleep. And it's easier for their skin to recover to trauma, basically. So when we look at something like transepidermal water loss, what we're looking at is basically we're damaging the skin and looking at how well it heals. And we can do the same thing by exposing the skin to sunlight. And so the studies have shown that good sleepers are more heal faster when exposed to those traumas compared to patients who are poor sleepers. And so for all of these reasons, the American Academy of Sleep Medicine has said that adults should be sleeping 7 or more hours per night. That sounds easy, right? But the reality is that's not what's happening. The CDC, the data shows that 35% of US adults are not getting the recommended 7 hours of sleep each night. And I think what's even more terrifying is that 6 out of 10 middle schoolers and 7 out of 10 high schoolers are also not getting adequate sleep. And, they're in their formative years, right? Basically their bodies are developing. And so, thinking about those consequences of long-term sleep, I think that's super important. And for all of those reasons, the CDC has listed insufficient sleep as a public health epidemic. We also see disparities when it comes to sleep, unfortunately, like many things that in our healthcare system. And so what we see is that non-white populations are more likely to not get the 7 hours of sleep compared to white populations. And the farther someone is from the the poverty line, or I should say below the poverty line, they're also more likely to be getting less sleep. And this graph you can see here shows the darker brown are the areas where patients are more likely to be getting inadequate sleep. And you can see it's large parts of the South, areas of the US where we have more populations with skin of color and also lower socioeconomic status. So this is a big problem. All right, so let's talk a little bit about sleep and psoriasis. Now, how did I become interested in this? This is my patient, a real patient of mine. He was basically a textbook patient with psoriasis. He had 20 years history of severe psoriasis. He had psoriatic arthritis, and he had a lot of those same comorbidities that Guy just talked about in his last talk, but he was obese. He had hypertension, hyperlipidemia. He'd been diagnosed with liver disease. He'd had a heart attack a few years prior. So he could, he checked all the boxes of the things that we worry about for our patients with psoriasis. In addition, he had really hard to treat psoriasis. He had been actually referred to me by an outside dermatologist, having tried and failed a couple of different drugs. And I would love to say that he came to me and I was able to find the perfect combination of things to clear his skin. But unfortunately, that didn't happen. But he stuck with me and I followed him for years and we kept on trying. But one day he came in and this is what his foot looked like. And not to say he's clear by any means, this was definitely still active, but he was able to walk, he was able to function. What I didn't show you is his hands also look the same, and he was a guitar player. And so he was once again able to play the guitar and do the things that he loved. And so I asked him, I said, what changed? We didn't really change anything to your treatment. Like what happened? And so the interesting thing is he said, Dr. Bhutani, all I did was stop sleeping with my wife. And so first I was a little thrown back. I was like, what's going on? But it turns out that his wife had been diagnosed with sleep apnea. And because she was now sleeping with a big CPAP machine, they decided to start sleeping in different rooms. And unbeknownst to him, for the past many, many years, because of his wife's sleep apnea and her waking up multiple times in the middle of the night, he was also waking up multiple times in the middle of the night. And once they started to sleep in separate rooms, he now started to get that good sleep quality. And lo and behold, his skin started to improve. And he told me, he said, Dr. Bhutani, you need to study this. And he actually brought in that book that I showed you on the first slide, Why We Sleep by Matthew Walker. And so I got intrigued and I started reading the book. And I started to look into the literature about what had been published with sleep and psoriasis. What I did know was that there was an association with psoriasis and obstructive sleep apnea. This is a bidirectional association, so patients with psoriasis are more likely to have sleep apnea, but also patients with sleep apnea are also more likely to have psoriasis. So I had heard about this and I knew about this association. But I think what was really interesting from reading Dr. Walker's book and doing more research is that many of the comorbidities, just like I told you, that are associated with psoriasis are also associated with sleep loss. So cardiovascular disease, diabetes, depression, different types of cancers. But I wondered why nobody was not talking about this. There had been no other research looking to see if sleep could be a modifying factor in patients with psoriasis to see, is this influencing the development of their comorbidities, or is this making their disease harder to treat, as is the case with my patient. So there was a few studies that had been done, not a lot, but a few studies. This was a Taiwanese study. And basically what they showed is they took psoriasis patients and they separated them into patients who were sleeping well and patients who weren't sleeping well. And what they found is that the patients who were not sleeping well had a significantly higher risk of ischemic heart disease or stroke compared to psoriasis patients who were sleeping well. So again, this was a small study from one country, but a really important finding, I think, to help reiterate that sleep could be a modifying factor in that pathway from psoriasis to cardiovascular disease. This was really interesting too. This was a study that looked at the Nurses' Health Study, which is a very large-scale study looking at nurses over a long period of time. And since many nurses are night shift workers, they were able to find that compared to those who reported no night shift work, those who were working night shifts had a significantly increased risk for even developing psoriasis. So, could sleep loss be one of the triggering factors in even unlocking those genes and making someone present with psoriasis? This was a study that we did here at UCSF using data from the National Psoriasis Foundation, a data set called the Citizen Scientist Cohort. And what we found is that psoriasis patients are not sleeping well. So about 60% of psoriasis patients in that survey reported some type of trouble sleeping, and about 40% of those patients said that they were sleeping less than 7 hours a day. This sleep disturbance was associated with the severity of their psoriasis. So the more severe their psoriasis was, the more likely they were to have this sleep disturbance. And it was also associated with things like psoriatic arthritis, female gender, having a higher BMI, or if they were smoking. So we know that this is a problem for our psoriasis patients. This is another study that we just completed where we looked, the last study was just looking at psoriasis patients, so we didn't have any populations to compare them to. But in this study, we looked at data from a large national data set called NHANES. It's been used a lot for different disease states. And what we were able to do was compare sleep in psoriasis patients to healthy populations. And just as expected, we found that psoriasis patients were more likely to report trouble sleeping compared to those without psoriasis. In fact, they were almost 80% higher at risk to report trouble sleeping than someone without psoriasis. And I know what you're thinking, psoriasis being itchy, psoriatic arthritis being painful, all of these symptoms kind of, will make it harder to sleep, right? That's probably what is happening here. But what's interesting is that there's a lot of, there was a study done that looked at almost 3,000 patients with different cutaneous disorders, not just psoriasis, but eczema and other things. And what they found is that the symptoms that patients reported, such as itch and pain, they were associated with the sleep disturbance for sure. But even if we were to control for those symptoms, patients still were not sleeping well. And so there was something else going on that was leading to sleep disturbance in these patients. This has also already been proven in other disease states like inflammatory bowel disease, where patients, even when their disease is well controlled and they're not having any symptoms of their disease, they're still not sleeping well. And what I told you before is that sleep is really important for the immune system in order to keep the immune system healthy. But what I didn't tell you is that this actually seems to be a cycle as well. And when the immune system is activated too strong or too long, such as in a disease like psoriasis, this actually in itself can lead to disturbed sleep. So even when patients' symptoms might be under control, such as their pain and itch, that upregulated immune response is still leading to disturbed sleep in the long term. So again, this becomes a vicious cycle. We have this hyperactive immune response like we see in psoriasis. This leads to worsening of skin disease, which is leading to sleep loss, which further dysregulates the immune system. And as you can see, this just goes on and on unless we intervene. So for future directions, this is what we're calling the UCSF Dreams team. It includes myself, Dr. Wilson Liao. We have two prominent sleep researchers, Eric Prather, whose studies that I mentioned earlier, and Dr. Andy Crystal, as well as epidemiologic sleep researcher Katie Stone. And we formed this team in order to study sleep further in patients with psoriasis. This is the DREAMS PSO study. This is actually being done in collaboration with the National Psoriasis Foundation. So a lot of those grants that Guy just mentioned, many of those have helped me to further my career, including this one. And in this study, we're actually taking patients with moderate to severe psoriasis, and we're putting them in a sleep lab for 3 nights, which is a really hard task, and I appreciate my patients so much for helping me with this. But in this way, we're going to be able to get really robust data on how they're sleeping, not just the time that they're sleeping, but the quality of their sleep. How many times they're waking up in the middle of the night? What do their sleep cycles look like? We're also drawing blood, and we're going to be looking at the association of those sleep cycles with their inflammatory markers. So does that sleep influence their immune response? Does that sleep influence their psoriasis? And then in the future, we're designing a study called the DREAMS PSO Pro or prospective study, where we want to do this study, but we want to do it at home because we realize that sleeping in a sleep lab is not the same as sleeping at home. And so we'll follow patients for long periods of time while they're sleeping at home to try to evaluate their sleep in a real world setting. And in this study, we hope to also be looking at those comorbidities like the development of cardiovascular disease and diabetes over time. But in the meantime, what can we be doing? So here are some tips and tricks from my collaborators, from Dr. Prather, about how to improve sleep. So really important thing, first of all, is to maintain a sleep schedule. You want to try to go to sleep and try to wake up at the same time every day. And that does take time to reset your system. It's not going to happen overnight, but trying to maintain that sleep schedule trains your body, trains your circadian rhythms to get sleepy at a certain point in time and wake up at a certain point in time. You want to stay out of bed unless you are sleepy. So you shouldn't be doing other things in your bed because you want your brain to associate your bed only with sleep. Dr. Prather will say the only two things you should be doing in bed are sleep and sex. And so that's his words exactly. Keep your room cool and dark. There's lots of studies to show that decreasing your core body temperature can help you to get better quality sleep. Decreasing caffeine later in the day, I think, is obvious. So know your body and know that if you drink caffeine after a certain amount of time, that your body is not going to be able to fall asleep. Decrease late night alcohol. Again, lots of studies to show that drinking too late at night can actually help cause you to wake up early in the morning, make it harder to fall back asleep. Unplug before bedtime. I think we've all heard this about screen time and the effects of blue light on your sleep cycle. So trying to, if possible, keeping about an hour between your last exposure to a screen and when you fall asleep. Consistent exercise and physical activity are also super important. You want your body to feel tired at the end of the day in order to fall asleep nicely. And if you are going to keep naps are not bad, but you want to keep your naps short because you don't want to get into the deeper cycles of sleep when you're taking naps, because then that's going to influence your sleep later in the night. You want to keep them nice and short just so that you feel a little rested, you feel invigorated, but you're not influencing your nighttime sleep. And the number one thing, if you can follow none of these tips at all, is basically just to make sleep a priority. So you should be stopping everything that you're doing in order to get more sleep, because it is really important for your health and critical for your well-being. And that's all I have. Thank you to all my collaborators, to the National Psoriasis Foundation, of course, for allowing me to do this awesome research. And I can take any questions.
Wow, thank you so much, Dr. Bhutani, for your presentation. It does definitely sound like you guys are a dreams team. I can agree with that. So for the Q&A session, the first question we had from the chat was from Dennis H. And it was, would you suggest measuring cortisol as the measure for the concept of stress and psoriasis?
Yeah, I think it's a great question. Measuring cortisol is probably not the perfect way to measure stress, but unfortunately, we don't have great objective measures like blood tests or something that we can do to really measure the amounts of stress. So much of the research in psychology and other fields, cortisol is kind of the best corollary we have to measuring your internal stress response. But I totally agree that sometimes your internal stress response might not be kind of your personal stress response or what your brain perceives as stress. So there's definitely a difference there, but it's used in many, many studies. It's kind of a standard at this point.
I'll ask you one, Tina.
Yeah.
So you talked about some of the tracking devices earlier at the beginning of your talk. So I wear an Oura ring, which really helped me to understand where my sleep patterns were and to try to kind of identify some of those clues for myself of, what was I doing different on the weekends maybe versus a weekday that might be affecting my sleep, or the kids interrupting, right? You in the middle of the night. Do you recommend to patients that are trying to get a better understanding that they try a tool like that to try to see if there is some pattern to what's happening to their sleep, or if their sleep is being impacted that they don't realize?
Yeah, I really do. So I recommend these trackers to my patients all the time. The tricky thing is that these trackers, Apple Watch, Fitbit, or a Ring, they're basically using a technology called accelerometry. And so they're basically just looking at movement to estimate the amount of sleep, right? They don't have electrodes hooked up to your brain to see when you're actually sleeping and, things like that. So if somebody is itching in the middle of the night, or if somebody's kind of tossing and turning in the middle of the night, it'll pick that up as they're not sleeping, even though maybe they are asleep and they're just unconsciously itching. And so patients with skin disease, it's a little bit complicated, but I do still think that you get good trends And, you know, if you are waking up well rested and your sleep monitors are showing that you're not sleeping well, then maybe you are itching and you don't realize it, you know. So I still think it's important to kind of, you know, understand the different patterns of sleep. And some people get really motivated by it, you know, they like gamification, like, you know, they see it and they want to try to improve their sleep, so they challenge themselves. And so that's what I also like about it, is it really is a motivating factor to see it.
Thank you.
Yeah.
Another question from the chat, so from Natalie Thompson, is there an ideal amount of hours to sleep? Above 7 hours, but not as much as 10 or 11 if it's poor sleep.
Yes, yeah, that's a great question too. So yes, I think the studies have shown that for the average US population, that 7 hours of sleep is kind of the magical number, 7 to 8 hours of sleep. And so if you find that you need more sleep than 7 to 8 hours, sure, you know, there's certain people that might just need those extra hours of sleep, and that's totally okay. But you do want to actually think about, like, could there be something else going on, something like sleep apnea, or the quality of sleep? Are you waking up a lot in the middle of the night? Like, what else is going on? And so again, as Leah just said, you know, using a sleep tracker or something of those sorts to see what's happening in those 10 hours of sleep could be really helpful, because there might be something going on that we just don't know about.
Such a good point.
Yeah.
And another question from the chat, from Jan Dickinson. If you can't get to sleep, is it best to stay in bed or get up and maybe try to read for a few minutes?
That's a great question, and I think a question that Dr. Prather gets in his sleep clinic all the time. And the answer is yes. If you can't fall asleep, you should get out of bed and do something else until you kind of feel sleepy, and then get back in bed. Because again, you don't want that anxiety associated with not being able to sleep associated with your bed, basically, because otherwise the next time you get in bed, that same anxiety kind of comes back, and you probably will have trouble sleeping again. So you should only be getting in bed once you kind of feel pretty tired. Let's see, I see a question about, does lack of sleep and psoriasis increase the chance of getting cancer? So individually, we know that lack of sleep over the long term has been associated with increased risk of cancers, actually many different kinds of cancers. And psoriasis in itself has also been associated with an increased risk of certain types of cancers, especially things like lymphoma. And so although we don't have any studies that are looking at the impact of psoriasis plus sleep on the impact of cancer, individually, both of those do increase the risk of cancer. So I would think there might be an effect there, but I don't think we have the studies to prove it, unfortunately. Some suggestions for how to get better sleep. Reading an electromagnetics engineering book, that sounds like a perfect way to get me to sleep. Do you recommend a routine to get into sleep mode? I think it can be helpful, again, you know, for training your brain. I think it gets back to that, you know, maintaining a sleep schedule. I think we talk about this with kids all the time, right? We have our wind down time. You have this routine so that your kids know it's time to sleep. They start to get tired. You put them in bed. And so I think a lot of those things can also be used for ourselves, you know, that 1 hour, turning off the screens, maybe dimming the lights, lowering the temperature of the room, kind of prepping your body in order to get ready for sleep, I think can be very important. So yeah, I totally am on board for a routine to get people into sleep mode. Does taking medications that make you sleepy help or hurt your sleep, such as allergy medications, etc.? For the most part, these medications do help your sleep. What we don't know, especially in psoriasis, is, you know, overall it'll help your sleep, but we don't know, does it actually influence you to not get deep sleep? So there's different types of sleep. There's kind of the lighter sleep cycles, and there's deeper sleep cycles. And what we don't understand is if these medications will basically, you know, could it actually be decreasing the amount of deep sleep you're getting, but giving you more lighter sleep? And so these are kind of things that we're going to be studying in that long-term prospectives trial, is the influence of these medications on the actual sleep cycles. Another question from Dennis H. What are the most important moderators and mediators that increase or decrease the effect of sleep? If a patient is on a biologic that achieves PASI 100, does sleep quality still matter, or does bad sleep quality get a bigger effect if someone is exposed to an impact factor such as skin trauma? So I think I'll answer it one at a time. What are the most important moderators and mediators that increase or decrease the effect of sleep? To be honest, I don't think we know all of it completely, but like I showed in those studies, the amount of psoriasis that someone has, the more severe their psoriasis, or if they have things like psoriatic arthritis, does impact sleep. So we know that that will impact sleep. But to your next question, if a patient on a biologic achieves completely clear skin, does the sleep quality still matter? And I think the answer is yes. So again, we don't have the specific studies in psoriasis just yet, but in rheumatoid arthritis and inflammatory bowel disease, we see that even once the disease is well controlled, patients are asymptomatic, they're still having poorer sleep compared to patients without those diseases. So I don't think our job is done just by getting the skin clear, which is why I want to, do these studies to help study the impact of sleep interventions, because I think we can still make an impact even beyond clearing someone's skin. I hope that answered the question.
Thank you, Dr. Bhutani.